Your dental insurance company sucks. They are not your advocate. They are downright greedy and evil. Now, dentists, we're pretty used to being called greedy because, yeah, dental treatment out of pocket is not always cheap. And there's some bad apples out there in the profession who don't give us a good reputation. And we're kind of the face that people see that they get angry about when stuff costs a lot. So we're used to it. But I think it's about time that patients understand and see behind the curtain to know that insurance companies are the truly greedy ones. There's a simple equation that makes this make a lot of sense. It's just, how does an insurance company make money? Well, on the top, they have their revenue, and that comes from all the premiums that you pay or your employer pays every single month in and month out. That's how they make their money. The next one is what they pay as their expenses. Now, some of that is they pay their employees, but they have less and less employees as the years go on because AI does a lot of the work for them. Most of what they pay in expenses is the claims that they pay out to pay for your treatment. And then at the bottom is the profit. So it's their revenue from the premiums minus what they pay out in the claims for all of your treatment, and what's left over is their profit, what they keep. Well, what's their profit? They make billions and billions of dollars every year, but they're greedy, so they want to make more. Well, how do they make more? You would think, well, let's take the revenue and increase it. Let's get more people in the plans. That's hard, and that costs them a lot of money to bring more people in by marketing. What's the easier way to make more profit and keep more in their pockets? It's to decrease the claims they pay out. And doesn't that seem to line up with most of your experiences? Insurance isn't chomping at the bit to pay out more and more claims and help you get things fixed. If anything, they make it harder and harder and create more hoops for everybody to jump through for you to get your claims paid. Have you ever had a filling that needed to get done because of a cavity but it got denied? Have you had a crown planned for a tooth with a crack but that got denied even though it needed it? Have you needed gum treatment that got denied? Have you needed an implant or a bridge to replace a missing tooth and they told you a partial denture would be better because it's cheaper? There's a pattern here, and the insurance company just wants to find every possible way to pay less and for you to get less done, because the less they pay out, the more they keep in their pockets. And that's the only name of the game for them. It's dollars and cents and more profits. So bottom line is, they're not an advocate. They love that word, but they don't advocate for you. They advocate to find ways to make you need less treatment or for that treatment to cost less to them.